Greetings from Star Health Insurance. On the eve of World Diabetes Day, we are here with senior experts in the field of diabetes to have a chat on the knowledge and updates regarding diabetes. In this context, we have with us today Professor Dr. Murthy, who is Director for Endocrine Diagnostic and Research Center, Chennai, a very senior endocrinologist, and he retired as Associate Professor in the field of endocrinology from Madras Medical College. I have Dr. Periyandavar, who is currently Professor of Diabetology from Omandurar Medical College, Chennai, and Dr. Panneerselvam, a very senior diabetologist and a very successful practitioner who has been in the field of diabetes for more than 30 years. In this context, in India, majority of the people, they think about health insurance only when they are diagnosed with the disease. Particularly people diagnosed with diabetes and hypertension or combined diabetes hypertension, they are not aware that health insurance is available for them. And we from Star Health Insurance, we have come up with an exclusive health insurance cover for people already diagnosed with diabetes, where they can buy this policy irrespective of their blood sugar level or HbA1c status. And we are willing to cover them from day one. So we have come up with this cover for diabetes with an intention to really help them and be a support, financial support for them when they suffer from some of the complications of the disease. I think the better person to talk about this will be Professor Dr. Murthy. Sir, can you tell us what is your opinion about our intention to come for a cover for a diabetic from day one?
Till a few years back, the major problem for India as a developing country was infection. And with advancement in medicine and with the whole new drugs available, that got controlled. The main problem now is non-communicable disease. That is the burden, the health burden of India. And diabetes happens to be the mother of all non-communicable disease.
Health insurance, so far we are covering only illness. Now we have to move into promoting wellness and preventing people from falling prey to the disease. How we can really detect these patients at a very early stage when they don't have any symptoms?
So as you have correctly told, it is better to diagnose the disease early. So to diagnose the disease early, it is better to sensitize the entire population about diabetes. So like COVID, now the COVID, entire world got sensitized now about wearing the mask, social distancing, etc. Similarly, after the age of 30, everybody on the earth, especially in India, annually at least one fasting sugar, one postprandial blood sugar. That could be on the every birthday month or marriage day month or Deepavali month or New Year month or yearly once. Before food, it should fall less than 100. After food should fall less than 140. Similarly, one blood pressure checkup, one lipid profile, and height, weight, body mass index. It should be less than 25. For India, 23.9. So if they maintain this, otherwise I call this as whole disorders: hypertension, obesity, lipids, and diabetes. It should be diagnosed very early, or we have to sensitize the population from the age of 25 to 30 and tell the normal values to them.
So when it applies to reaching the masses, educated people can accept it in a very positive way. I want to know from Dr. Periyandavar, because he is a professor in a government medical college, what is the type of response you see from patients who come to medical colleges? How compliant they are when you want them to adhere to preventive norms?
As you rightly said, we are catering to the poorest form of people in the society. And those people, those who are coming, they are almost reluctant for treatment. So as Dr. Panneerselvam already told, once the complication comes, they come to us. Whether there is any kidney problem or some threatening eyesight problem or some burning sensation over the feet or some edema over the feet, fearing that kidney failure, they come to us. And if we say to admit the patient, it's very difficult to convince them for admission. We have seen patients with 500 milligrams, 600 milligrams sugar level. When we advise them for admission, they say, no sir, I have some job, my office will not give me leave. I have to look after my family, like that. Both the female patients tell like that, she has to go like that. And sometimes we have to threaten them, even for the admission. So that's the scenario in our government setup. And that too, even if we advise some medications, they will take for a few days or few weeks. Then they will stop it on their own. They'll come after 2 months. They say some lame excuses. So they say, sir, I have gone out of station. Where you have gone? If we ask, they have gone for Chengalpet. So they think Chengalpet is far away place. Like this, it's a problem we are facing, sir.
What is your impression on the cost that someone has to spend for constantly taking care of his health? Once he is diagnosed with diabetes, how frequently they should go for testing, and what can be the appropriate cost for such test, and how frequently they should visit their doctor? Because sometimes they visit doctor once and they continue to take the prescription for years. So what is your advice on that?
Now, I'll go one step earlier. Like the adage goes, health is wealth. So you have to invest on good health. So there is no compromise on not maintaining good health. And it is very easy. People have to be motivated. And what do you require for good health? You should have good lifestyle changes. Your lifestyle should be good. Healthy food habits, proper exercise depending upon the age of the patient and the morbidities or disease they may have. Cutting down stress. Stress is a very, very major problem now. So you have to de-stress. You have to avoid stress, whether it's meditation or a hobby or so. And another very important thing is good sleep, at least 6 to 7 hours of sleep a day. With this, major problems of health, not only diabetes, other health issues can also be prevented. Now, if you take any disease, you have got a genetic component, you have an environment component. The gene is what we inherit from our parents. We inherit good genes, we also inherit bad genes, we can't choose. But by lifestyle changes, which are part of the environmental changes, you can modify getting the disease. Either you can delay or postpone getting the disease, or if you get diabetes, it may be a very mild form of diabetes, and you could also postpone the progression of the disease and complication. So I would go more into the preventive aspect before coming to it. Now, at every stage, you could postpone problems. If fasting is 126, we call them diabetes. Now keep it is after food, it is 140, we say it is normal, 200. Doesn't mean that between 100 and 126, the person is going to be normal. So once you cross, it's a continuum. So everyone starts with 100 and moves on to 126, same thing also after food. It's a continuum at all levels, and a lot of data has shown that once you cross the normal levels, the complications of both micro, when we talk of small vessel disease like the eyes, retinopathy, neuropathy and kidney, or large vessel heart and stroke, that occurs. So we need not get bothered about these numbers. These numbers are only an indication, and once these numbers are crossed, it's a huge window of opportunity for the individual to correct themselves, mainly by lifestyle measures. Either keep the status at the same level, or reversal, like we say, go back to an early stage. So definitely, I would say this is most important.
Sir, very beautifully you said that it is not the blood sugar value that is important. The most important thing is living without stress and following lifestyle changes. So that's a very important point. Most of us are aware of it, but we don't take it very seriously. Now we have to follow these lifestyle changes. But you are talking about post-COVID-19, the response of diabetes is not the same. So I want to hear from Professor Panneerselvam. How do you see the difference between a routine diabetic patient and a patient who has suffered COVID-19 and then coming up with the high blood sugar values?
Yeah, especially after COVID, the infection rate or because of COVID infection itself, the diabetes is going high. While treating the patient for COVID, especially steroids are liberally used. After adding steroid, diabetes goes still out of control. Cytokine storm added, steroids added. So before getting admitted, the blood sugar may be fasting 120, post-viral maybe 180. After getting admitted to the infection, cytokine storm and inflammatory markers, fasting will go to 220, post-viral will go to 350. Then once they receive steroid and the infection is worsening, blood sugar goes even 600, 400. Sometimes before they die due to COVID infection, many of them are dying due to hyperglycemic non-ketotic coma. Because of excess sugar, they die because of excess sugar. Such things were happening during last second wave period. Subsequently, uncontrolled state only invited all your mucormycosis and all. So this is about non-diabetic entering into COVID infection and coming out. Sometimes normal people at the time of admission they found to be normal. During infection stage or severe infection, they develop diabetes. Due to again cytokine storm or infection or steroid, they develop temporary diabetes. After discharge, invariably they become normal, but they are all future candidates for diabetes. They require further monitoring. Pre-diabetes, they enter into COVID, they become frank diabetic once they recover. Otherwise, the mortality rate also among the death, among COVID death, 25%, even 30% due to diabetes and uncontrolled hypertension only. And COVID, another component, social component, financial component, stress-induced COVID. I may develop COVID. I lost my income. I lost my job. Such stress also put the pressure on the population. The diabetes is getting worsened, hypertension is getting worsened. Otherwise, COVID has not only changed the economic aspect and financial aspect, social aspect of the population, and health-wise also, especially diabetes and hypertension also got tilted towards negative side. The sufferings of the individuals are more.
You are right, sir. Regularly, once in a year, it is better we check our blood sugars. Particularly those who are being diagnosed with COVID, it is always better that after they get discharged or after they get all right, they do their blood test and then consult a diabetologist. Some patients who are already diabetic for 10 years, 15 years, they have a false impression that they can treat their diabetes themselves. And sometimes they also advise others. This is the drug A, drug B I am taking. You can continue the same drug. Dr. Periyandavar, you can tell us what is that you want to advise our audience on what type of treatment, what are the different types of drugs, how the treatment differs from patients to patients. It is not the same prescription that can be used by all diabetics. I want to hear from you.
Before going to answer your question, I should explain to the audience about the types of diabetes. There are 4 types of diabetes. One is type 1 diabetes, which comes in children, wherein the pancreas will lose its potency to secrete insulin. Maybe we can say, in other words, zero insulin production. Okay, for them, treatment is only insulin, no other choice. Okay, so that we will confirm with some of the tests like C-peptide, serum insulin assay, and other clinical assessment like incidence of diabetic ketoacidosis. Okay, so for them, treatment is simple. So insulin is not there, so we supplement insulin. That's the thing. And the second type is type 2 diabetes mellitus, which comes in usually in adults. Nowadays, as you have already mentioned, patients at less than 18 years also getting diabetes, the type 2 diabetes coming in the younger age. So we call it as type 2 diabetes in the young. So maturity onset diabetes in the young, like there so many nomenclatures are there. So in that group also, we have to very carefully select medications. Whenever there is very high sugar, like fasting sugar more than 250, 300, and after meal sugar more than 300, 400, like that condition we sometimes call it as glucose toxicity. In that group of patients, initially, whether it's a type 2 diabetes or whether it's type 1 diabetes, we have to give insulin only for a short period until we overcome the glucose toxicity, until we bring down the sugar levels to normal, bringing them back to normal lifestyle. Then we can plan adding oral tablets. Okay, so before going to oral tablets, we consider whether it's a obese or non-obese. Okay, so whatever it is, international guidelines given by all American Diabetes Association, the American Association of Clinical Endocrinologists, everybody says the starting treatment is metformin, which many of your audience may be aware of it, but that's a headache of doctors to prescribe it. So the level 1 medicine metformin, if it fails, they will go for level 2 medicine, and if it fails, go for level 3 medicines like insulin and added oral tablets, like that it will sequence go on. Okay, but whatever the treatment, medications doctors change, every visit we advise our patient to follow, as Dr. Murthy sir said, lifestyle changes. Every visit we will advise the patient whether they are following our dietary advice, whether they are following our advice on exercise. So like this we will be monitoring, and if after many years after detection of diabetes, like 5 years or 10 years after diabetes, because you all know diabetes is a progressive disease, so over the period of time all the tablets may fail. In that case they may have to go for insulin. Okay, so many people will think once insulin, lifetime insulin. That is a wrong concept, and this is regarding type 2 diabetes. And there is third category, that is gestational diabetes, and until few years back the only treatment available was insulin that was highlighted by many treatment guideline authorities. But nowadays some guidelines say metformin also can be given in initial stage, but still we feel insulin has more edge over these other oral tablets in pregnancy with diabetes, that is gestational diabetes. And fourth category comes like secondary diabetes, secondary to some endocrine disorders, or some after post-COVID their patients receiving steroids. So whenever patient is on steroids, definitely insulin is drug of choice. Okay, so once they stop steroids, naturally diabetes is reversible. Okay, so like this the treatment is planned for, not single treatment fit for all patients. So it should be individualized.
Sir, very important, sir. You told about gestational diabetes, meaning that a person being diagnosed as diabetic at the time of pregnancy. I want to learn from Murthy, sir. So, gestational diabetes, how cautious a girl who wants to go into the family way, or who are just getting being diagnosed for pregnancy, what precaution they should take, how frequently they should check their blood sugar, and what are the complications if they don't take care of their blood sugar, or if they are not aware of the diagnosis of diabetes during pregnancy, what are the complications that they can have? So we want you to enlighten us on this.
So the problem in pregnancy doesn't stop with the mother and fetus. It can go on to the next generation also.
So that's very interesting to know that a girl before becoming pregnant should check her blood sugar, and during pregnancy also they have to check the blood sugar and take the right medical advice from the treating diabetologist or endocrinologist. So this is very important. But I want to ask you, sir, once the pregnancy is over, will they continue to be diabetic for life, or what percentage of them can come back to normal?
Now what happens is post-delivery, we are talking about GDM, that is glucose and diabetes mellitus, that those people who had high sugar during pregnancy and before pregnancy they were normal. A fair or large percentage of them revert back to normalcy during the postpartum period or delivery. But they stand a high risk of developing diabetes later on in life. So they have to continue with lifestyle changes, mainly periodic blood sugar checking, so that at any time intervention is given. So at an early stage they have diagnosed. So a high risk of developing diabetes later on in life, though immediately postpartum. On the other hand, those people who had diabetes became pregnant, usually in the postpartum period, the amount of medicines or the dosage of insulin may come down, and you have to taper and continue.
Very nice. So regular blood sugar checkup is very important after delivery. But sometimes, sir, people on a regular checkup, suddenly they see their HbA1c, which is supposed to convey the control of blood sugar for the last 3 months. Suddenly they see a HbA1c level of 11, 12 and all. So I want to know from Professor Panneerselvam, What is your advice for a diabetic who has not been under regular follow-up and suddenly he comes with a HbA1c of 11 or 12? Is he at a real danger or risk? What is your advice to these people?
Right, sir. You have asked a very good pertaining question, sir. Because to start with, every patient listen the advice and bring down the blood sugar and maintain the blood sugar also. For example, at the time of diagnosis, fasting may be 200, after food may be 350, A1C may be 8. Then for 1 year follow-up, they will bring down the A1C even to 6.5, fasting blood sugar 100, postprandial 140. 1 or 2 years they maintained. Then subsequently, I could say 70 to 80% of our patients, in this 70 to 80%, 60% of them are literate class, they know what is the consequences. Despite that, they either discontinue the treatment or not adhering to the diet advice, not doing the exercise, and not monitoring also, not coming for follow-up also.
So I want to hear from Dr. Periyandavar, what are the type of complications if somebody is not going to take the advice of a doctor and sincerely follow up with the doctor?
Good question, sir. Actually, complications are dreadful in diabetes. And we can divide the complication into two things. One is metabolic complication, which is very common in type 1 diabetics in children. So if they don't take treatment properly, if sugar is very high, they can easily slip into one condition called diabetic ketoacidosis. Okay, that's a very dangerous, life-threatening condition. And in adults also, when sugar levels are high, like more than 500, 600 milligrams, we call it as hyperglycemic hyperosmolar state, like that, one complication. That is a headache of doctors to treat. But as a general public, you should concentrate on prevention of vascular complication. That is, diabetes is a silent killer which can silently damage blood pipes of your organs. Okay, so we divide the vascular complication, that is complications affecting your blood circulation, that is microvascular and macrovascular. So microvascular means those who are diameter of very small thing, that is diabetes damaging nerves, that is diabetic neuropathy, diabetes damaging eyes, that is retina, that is diabetic retinopathy, and diabetes damaging kidneys, that is diabetic nephropathy. These three are microvascular complication, we say. And the second thing is those blood pipes which are little wider, that is macrovascular, we call. That is, one is common is coronary artery disease, which nowadays even youngsters, young diabetic patients, 30 years, 35 years diabetic patient having acute heart attack, acute coronary syndrome, getting admitted. Okay, so this is a very common macrovascular disease. And the second thing is, very common is peripheral vascular disease. So blood pipes supplying your legs, they are getting, if they are blocked, what will happen? It will be gangrene will come. So many people will argue with me, sir, when I have sugar level 600, my wound has healed well. When I have now, you have controlled it to 200. Now, after 5 years later, now I am losing my limb because of gangrene. That is because when sugar levels are 600, when wound is healed, it means your blood circulation is good. Whenever we give antibiotics, it will reach the site and wound healing will be proper. So after 5 years of uncontrolled diabetes, what will happen? If blood pipes to the legs are blocked, then your antibiotics will not reach. Oxygen will not go there. So they will get gangrene, and losing limbs is a very common thing. So this is a dreaded complication. And one more macrovascular complication is stroke, which is nowadays stroke incidence is less when compared to previous years. So, but anyhow, we are getting then and there the stroke also. But the common thing is coronary heart disease. So ultimately, by controlling good diabetes level, that is, as Dr. Panneerselvam said, sugar levels, fasting sugar less than 125, and after meal less than 180, and HbA1c less than 7, definitely we can prevent this diabetes complication, all the vascular complication in the adult patients, as well as in the youngsters, they can avoid these metabolic complications as well.
That's very lovely and very relevant reply. Dr. Murthy, can you just give us the carry home message? What is your advice for all our audience here?
There is nothing to be concerned, worried about. It is only a warning sign and alertness at any time. So whether you are in the early stage or at an established diabetes or complication, lot of things could be controlled and reversed. So there is nothing to get worried about it. Only thing, it's very important that discipline in life comes. I think whether a person has got a disease or not disciplined in lifestyle, pertaining to exercise, pertaining to food is important. Now, coming to food, there is no special food for diabetes. It is all your traditional food which you eat, which your forefather ancestors have been eating. Only thing certain gamete like you would like to avoid, cereals which are polished, like maida or rava or vermicelli. Go for whole grain. And so also high fiber, which is also there in the pulses with the skin. High fiber is very important for them. And it should be a balanced diet of carbohydrate, protein, and less fat. Don't go for all these quick fixes diet, the various diets which have been thinking it's not going to help you. For people who got high sugar and for that matter any health issues, there is no fasting or feasting.
Sir, our sincere thanks to all of you for sparing your time and sharing your knowledge, and to all our beloved Star Health Insurance customers, we wish you a very healthy and a peaceful living. God bless.